Mazarski.
And just be aware that if it's not on the agenda, there won't be any discussion, but we're here to be listening.
Right, okay. We own the former 7-Eleven at 444 Main Street in Yarmouth that closed in December. And we've been working with 7-Eleven to try and reinstate their tobacco license that lapsed because 7-Eleven closed. And so since 7-Eleven closed, they missed the June 30 deadline. So it's my understanding that that license is now expired and gone, and the cap's been reduced, But we have a tenant here who'd like to lease the space, and so we'd like to see if there's any way to reinstate that license.
All right.
Yes, I know this is just public comment, so there's really not discussion with the
Right.
board. I did receive a letter from Jason Wednesday afternoon. I was not able to put it on the agenda. He pretty much stated what his request would be that would go on for the next meeting, because the cap, there is a cap. 7-Eleven left. They did not turn their license in, so the cap is reduced by that one number. And that's the way the regulation reads. There's really no, it's not a current person holding a license. That person left town. So it's a little different than a couple of the other ones that the board has heard in the past. So if the board wishes, I can put it on for the next Board of Health meeting that we have.
Well, what do people think?
Yes. Sure.
Okay, sounds good. Sure.
So that would be April
Absolutely.
6th is the next meeting that the board would have.
Perfect.
Let's stay in touch communication-wise. So right now, it would be April 6th at 5 o'clock.
Okay.
Okay.
Sounds good.
All right,
Thank you
we'll
very
see
much.
then. Yeah, sure. Okay, next. It's a discussion. It's White Ribbon Day, March 5th, 2020, and that's located at Cape Cod Community College. Mr. Murphy, is there something we need to know about here?
Yes. You all should have a flyer in a ribbon in your packet, and I'm going to have Meredith, our summer or full-time kind of person that's working with us, give you an update.
So the White Ribbon campaign started in Canada after a massacre. 14 women were murdered in Montreal in 1989. So a group of pro-feminist men in Ontario started this movement to raise awareness of the prevalence of domestic violence against women in 91. And now this campaign is celebrated in over 60 countries. The Cape Cod's National White Ribbon Day is in collaboration with the Yarmouth Police Department, the Independence House, which is an organization that helps victims of domestic violence connect with services and get resources, and the Cape and Island District Attorney's Office. So we'll be in the cafeteria from 11 to 1. There'll be a whole bunch of different tabling activities to connect with the district attorneys, police officers on the Cape, as well as counselors. And the goal is to raise awareness and have meaningful conversation and interactions with mostly men. The idea is to ask them to take a pledge to not commit, condone, or remain silent if they ever witness domestic violence.
The turnout's been great at these when I've gone. A lot of people show up.
Yeah, and it's on the, it used to be held at the motel here, Irish Village, for a few
Right.
years, but they wanted to try to increase it to get more of an outreach, and they worked partnership with the community college, which worked out very well last year. So as the subcommittee planning for this, Meredith was on the subcommittee at Independence House, along with a representative from the police department and Mallory from our department. So Meredith probably attended 3-4 meetings maybe on this. So that was helpful. She put a lot of effort into it, so that's great. You'll notice that Yarmouth Board of Health is noted on the application as a organization, sponsoring organization. So I think that's helping with our board's outreach within the community and working with Independence House. And maybe you can discuss a little bit what our table will be and who's going to be at our table.
Our table is going to have a survey that was provided by Independence House, and we're asking for true answers, true or false, if given scenarios, if men would know how to react. For example, if they hear an inappropriate misogynistic joke in the locker room, if they would laugh out of, fitting in, or if they witness someone hurting their girlfriend if they would feel comfortable standing up and saying something. So we'll have that survey, and then we'll have some examples of celebrities that are not held to higher standards, that have committed domestic violence or have been prosecuted, yet they still have large fan bases and support. So the idea is to show people that we need to hold everyone to a higher standard and have good role models.
Good.
Okay.
And who's going to staff our table now?
Bruce, Mallory, and I, and Kevin.
Bruce Murphy is? Bruce Murphy.
Bruce Murphy will be there. Yes.
I was pushing for the cupcakes on our table, but we got pushed to the survey instead.
Sorry about
That's healthier.
Yes, the obesity question.
Yes.
going to say.
The other tables that I think there'll be a table from the Cape Cod Community College group. And who else is going to have tables?
The district attorney's office will have a table, and they will actually be taking the pledge alongside anyone who wishes to. There will be another social media table about representation in the media of ads. Then there will be an Independence House table that has counselors available in case anyone would like to talk on the spot, because it's obviously very triggering information.
So if any board members want to stop by this Thursday, 1 to 11, just 11 to 1, to see how it goes, that's welcome. But appreciate all the effort that you put into this, get this going.
Great, thank you.
Thank you.
Nice job.
So stay right there. You're on our next agenda topic, too.
He's tough, huh? Don't get up. Okay, number 3 here, discussion, second housing inspector position. Director Murphy, anything you wanted to say?
Yes, the board has had this on their agenda a couple times this year already, supporting the request for a second housing inspector. And just because Meredith was here, I just wanted to kind of have her give an update of what she's been doing the last year, the number of inspections and so forth. The budget will be presented to the Board of Selectmen Monday, March 16th, about 7:30. I present my budget with the challenges of, one of the challenges within the budget is housing inspections, the safety, and making sure we're getting enough done. Is why we need a request, and we have the funding for it. So we'd like a couple Board of Health members present on that Monday, the 16th, if possible.
You thought it was around 7 o'clock.
But yeah, I'll get you the time, but there's a couple on ahead of us, so we'll do that. We have made the presentation to the Finance Committee. They have not taken a position yet at this time. So we just wanted to get that back out to the selectmen. So I'm going to just pass out, not everybody got some of the stats in their packet, so if I could just pass them down, and then Meredith can just go over a couple things that she's been doing.
I have.
Okay. So if you can just say, she has worked with our housing inspector, Kevin, going over rentals and inspections. If you can just say kind of a quick overview.
The whole process can be kind of complicated because of challenging owners and challenging renters. So getting the inspection scheduled is hard enough. Christine has to deal with that. So we've received a lot of complaints recently that require a lot of conversations, follow-ups. We always try to schedule an inspection that works best for the renter and the owner and all parties involved. So recently we've had some complaints about abandoned properties and rats in the neighborhoods, that it's hard to pinpoint exactly where it's coming from or who's responsible to take care of it. So we've been dealing with a lot of running around to find someone to take action, which is very time consuming, a lot of letters, certified mail, phone calls, just to actually complete the inspection, which a lot of times the inspections, there's violations that do not meet the code for the minimum safety standards, which requires more follow-up letters to the owner and orders to get things fixed and mitigated.
You're also doing, we have about 3,200 rentals that we keep an eye on right now and require inspections, so that's a lot for one person to make sure they can get in and do inspections each year. And that's not following up on a complaint or trash or no hot water, broken screen, broken doors, questions like that usually take multiple calls, follow-up, and inspection. So it's hard for one person to do all that. And you can just see the number of housing inspections that Meredith was able to do. She almost did about 450 inspections, so that was a big log helping the department, along with a lot of letters and complaints and follow-ups that Meredith was able to do that would have been difficult for us to keep checking on people and making sure property's being kept up and rented for the safety of the tenants.
I think safety is a key word in all this, for sure.
Safety.
The other thing maybe you can just mention about money, okay? Often, unfortunately, is what it comes down to, and some of the economics involved.
Sure. The rental program, it's $80 for a year, which is, probably a pretty good fee that you're getting your, property inspected every couple of years or so, making sure your house is safe. We also think that the owner should be doing a check during the year or having a management company check. They should just at least drive by to make sure the property's being picked up and cleaned and the yard's been raked and so forth. The sideboards aren't falling off the house, the window's not popping out or something, that helps. But for the money that we bring in to what is needed for the operation, we bring in over we'll project to bring in about over $200,000 part of this program, and to run the program's only about $178,000. So we're bringing enough money and turning money back into the town, even if we project a housing person coming on board with benefits.
Right.
So we can pay for the program. I know when they look at it, they want to know if there's any new property, because a lot of times that extra money has been committed. But we have at least 1,200 units that are apartments in town that pay each year. We do have a couple new units that came on. The old Cavalier just came on as an apartment building now, so that's new money that will come in each year of approximately $5,000. That's new. And what we're also seeing is an increase in number of people applying for their rental permits under the state short-term rentals.
Right.
So we're picking up a lot of new people that hadn't registered in the past or had registered and kind of fell off our grid if they didn't hear from us, but now they're coming back. So one is we would get a rental fee from them, and as they're a short-term rental, they're going to have to pay that town tax also. So it's almost like a double win, because we get our money and the town gets some additional money. So that's very helpful. And we've planned, Christine tracks the number of new units as they come in, and we're at 50 new houses this year that were not on from last year. So, and she has a nice little system to keep track of it. We all work on that. So, so we feel that with new units and the additional money, I think for our presentation to the Finance Committee, and that we'll make to the Selectmen, that we feel very comfortable that we can do that within our existing budget.
So encourage board members to, if you can, come to the meeting.
Yes, we would ask to join yourself, because I believe you'll be there, Mr. Chairman.
Yes.
Can you repeat the date and time of the meeting?
Monday, March 16th at approximately 7:30, and I will email that time out probably that Friday, finalizing that time.
Okay.
Thank you for coming in. We got her on TV the last time, and the
TV didn't work.
TV did.
Yeah.
I'm sure
So-
she's thrilled.
Thank you. My big moment.
We're gonna sell the tape. You're on it. If you'll sign some of them on the front, it'd be great. We'll make some money on it. Just as, all right? Good video. Okay. Agenda now. It looks like number 4 is a hearing request for reinstatement of tobacco license Bucky's 1, located at 528 Buck Island Road, West Yarmouth. And underneath there, it's saying tobacco license cap, reinstatement time frame. And it looks like Number 5 is the same thing, except it's a different location. It's Bucky's 2. So maybe we can do these together. Director Murphy, anything you want to share with us so the board knows what we're here for tonight?
Right, just for the people at home and refreshing with the board is the Bucky's 1 and Bucky's 2 did not file their retail permit or their tobacco permit by the end of the year, nor did they file it within the 30-day grace period. Therefore, their tobacco license was basically taken away, or it goes back under the cap. They're not allowed a license. They did come back to the Board of Health, appealing that question and asked for reconsideration. After a discussion, the board did allow the license, even though there was a cap, to go forward with a 60-day suspension. And you have the letter before you today asking you to reconsider that 60-day suspension.
Okay, someone here
Yes.
reference that? Oh, great. Come on up. Just introduce yourself. Thank you.
My name's Rebecca Turner. I'm
Once
the
again,
manager.
you have to be near the mic for
Sorry.
people at home to hear you. We can hear you. but-
Sorry. My name's Rebecca Turner. I'm the manager of Bucky's. And the reason why I wrote the letter is because after a couple of weeks, it became obvious to me what the real loss was. I mean, the actual amount of money lost was staggering to me. I didn't, we weren't really in a position to argue, but now we're in a position to sort of ask you, kind of plead for, us to be able to get our license back because we have regular employees that depend on the income, myself included. I have a disabled son at home. I need this job, and the amount of money that we're losing is frightening. And I don't know that we could last another month. I don't know if it can be sustained, and I don't think that you all want to see a business fail. I just don't think that. We made a mistake. The license renewal was emailed, and my boss went out of the country right around the same time. So, I mean, it was missed, and we know that. But we've lost thousands of dollars, and we get it. It's not going to happen again. I mean, it can happen again. We won't survive it. So I'm here basically to beg for reconsideration. Maybe it can be, we can go back. I mean, at coming June, we're going to lose all menthol too. So just, I know that's not your fault or your problem, but the reality is we're losing thousands of dollars, and it's just not sustainable for us. And I hope you can help us to not lose the business.
Well, I understand why you came back, for sure. People, board, some comments, anything?
I don't have a problem with reinstating it. That's just me.
Just bring the mic closer to you so people at home can hear you.
I said I don't have a problem reinstating it, but that's just me.
Okay. Anybody else? Any feelings?
Can I just make one more? We've been in business for 30 years in this town. We have an established clientele. You know, when you don't have that item, people come in and they look and see and they leave. And I'm losing that too. That's just, I'm figuring bare minimum loss. It bleeds into everything else. So I hope you will reconsider.
What day did you take all your, I know we instructed you to take the tobacco off the shelves, and I believe you did that day, probably, I think, January 31st.
Yeah, I think it was the 31st. I'm pretty sure that was the day, Philip?
Yes.
Yes.
Came
I
by.
didn't know ahead of time that it was coming at all either. I mean, it's no excuse, I know. I'm not trying to make excuses, but any fines that may have been levied, we've definitely, it's never going to happen again.
I think one thing that influenced this board was the fact that 5 out of the last 6 years.
I
your
know, but
business
I mean, in all fairness, that's
has
past, it's gone by. I mean, we're trying to save our business now. I understand what you're saying.
I think that had a major influence. It did on me anyway. It was just.
Yeah, me as well. It's
Well,
a pattern.
he's never operated illegally. I mean, maybe he was late renewing his license.
Interrupt you. No, that's not true. You're selling tobacco without a license, right?
I don't know. I mean, I haven't been with him except for the last 3 years, and I don't think it's occurred in that time until now. I don't know.
Maybe you can help me out here. I mean, after December 31st of any year, if you're selling tobacco and you don't have a license, right, that's against the law.
Correct. There was several years that the license was not submitted until later into January, so they were without a tobacco license or a retail food license when they were open.
I mean, as a
For the
manager,
years
you
15,
know that.
16, 17.
Well, I didn't know that. I did not. Not until this time, I didn't know. I mean, I just got the management position this year, so I did not know that. But I'm saying to you that in 30 days, I don't know if we're going to be able to sustain the losses that we've incurred as a result. And we're just hoping that it can be reinstated, or it's possible that the business will close.
Any other comments? I mean, appreciate you. Anybody else?
I certainly don't want to see businesses close in town because I do realize that they are people.
Get the microphone in front of you.
That they're people. So I don't want to see businesses closed in town. However, there is that pattern. We have rules, we have regulations. We are trying to do things to help make the community healthier. And this thing about being late for licenses is happening a lot. And it's wasting the time of our public health personnel who could do more important things than try to run down people who haven't submitted their licenses or deal with them when they haven't and they come in and they want to try to take care of it. So
We're going to lose our business, though, in 30 days. We're not going to be able to sustain the losses. So, I mean, that's where we're at. I mean, I don't know. I understand these things happened in the past, and it's also months before we ever physically received the paper. So I think sometimes there's some confusion about, I mean, at least this time, when the boss was away, I said, are we all set renewing everything? And I think he thought he had, because it takes months before he actually gets the thing in his hand. So somewhere in his mind, it sort of got crossed. But I don't think this is an intentional thing. I mean, and we're sorry for that. But I'm coming to you today and asking that you save our business. We're not going to do this again. I mean, this loss has never happened to us before. And, I mean, like I said, I'm a single mom. I have a disabled child at home. And there's other employees that depend on this for their livelihood as well. And, I mean, you guys can make or break us. And I get it. We made a mistake. I'm sorry. That's really all I have to say.
I mean, with this dire situation, is there a reason why the boss didn't come tonight?
He's working. He had to cover somebody's shift.
Okay.
Ms. Turner, what's the procedure going to, should you be able to stay open, what's the procedure going to be in the future to make sure this doesn't happen again?
I'm going to take over. At least this. It's, when is it, January 1st? What's the date that they
December
have to?
31st.
Yeah, so on
It's
December the
January
1st,
to December 31st.
on December the 1st, I'm going to make sure it's done. I'm going to, put it in my phone, an alarm on my phone, so that every December 1st, I'm going to pay it before it gets to the point where it's even close to late. I mean, it's not going to happen again.
You're the manager of both stores?
I'm the manager at 528 Buck Island Road, but I can certainly, do both things. This falls into my area of responsibility, yes.
Is there a reason why the other manager would come tonight? This is, you're
He's
describing a dire
working.
situation. Yeah.
He's covering a shift for somebody, so that's why.
I mean, tonight's meeting is pretty important obviously for your business. That's all.
Well, it was close the store and come, or cover the shift, and so he sent me.
Comments? What people want to do here? I mean, right now, we don't have to do anything. We made a decision, but if anyone wants to change their decision, then this would be, I think, the time to do this.
I mean, personally, I think that they've probably lost a significant amount of money in this period. It's been 30 days. I don't think as long as Ms. Turner's there, it's not going to happen again. Should you not be employed with them, it could happen again, and then I think all bets are off.
Mhm.
It's my opinion.
I don't see me not being employed with him, and even if I wasn't, I'm still going to
Could
call
win the
him.
lottery, you never know.
I'm still going to call him. Did you?
How's that going to affect the other store? No,
This is going to be my responsibility, to the licensing part of things. I mean, when he was away, it was me that did all the running around to maintain our grocery license that same day. Unfortunately, we weren't able to do that with a cigarette license because of whatever. I mean, you understand it better than me. But it's not going to happen again. Absolutely not. I mean, I want to keep my job.
Sure.
The license applications go out approximately the last week of November. So they're I'm not sure when
I
it was
think
up.
it was emailed to him, and I don't know if that's a typical thing.
Yes, people that have email addresses get emails that did not bounce back. People that want mail, we
He
go
may have
mail.
received it, but I'm not sure he ever saw it.
Yeah,
I don't know.
Yeah.
I mean,
it's the,
usually, I think he's over however things were done before I was there, but I think it was a typical mailing thing.
right. It's also on the application when you renew your license each year. Before you, right above your signature, it says license must be renewed by December 30th, or you lose your tobacco cap. So, I mean, there's a couple ways that it's noticed, that it's sent out there.
Yes, we made an error. We
Right, I understand that. But I think he was probably still in the country at maybe at end of November, the 1st of December. I'm not sure how long he was out, but, notice was way
Yeah, I'm
given
not
way ahead
making
of time.
excuses. We missed it, obviously, and
Do you have a bookkeeper that does books that would also be aware of that permits, when permits are due?
that I'd have to ask him. Honestly, I don't. He has an accountant, but no, not that I know of.
One concern that I have personally about reinstating the license immediately would be that Buc-ee's would be receiving the same penalization that, what was it, Becker's
Right.
had, but Buc-ee's has a significant track record.
We've been in business for, 20 times longer than him. And we've put a lot into the town as well, a lot more than he has. So, I mean,
You realize the board, in some ways, did you a major
Yes, I do,
favor.
and I do appreciate
You
that,
would not have
but-
2 licenses now. The regulations we such, you would not have tobacco licenses
I
now.
understand that. But I'm looking at the dollars and,
I'm sure.
we're mortally wounded.
That $20,000, was that both stores or just yours?
No, that's a combination, but,
Okay.
I mean, That's a lot of money.
You ain't kidding.
So, we don't have to take any action unless somebody wants to, that's all. I'm correct? Director Murphy, that's correct?
No, Charlie was,
If you want, sure.
I'd like to make a motion to reinstate the license at location of 528 Puck Island Road, West Yarmouth. I guess that's about it, isn't it?
1040, and 1047.
1047
Route 28.
28, I'm
Right,
sorry.
both stores,
South
yeah.
Yarmouth.
Can I add to that, effective March 9th, which would be a week from today? Which would be a week longer than the Becker's fine. I'd like to add that to the motion if I could, or make my own.
Well, a week from today?
A
or
week from
the
today.
31st?
A week from today, so it would be March 9th.
Okay, all right.
We need a second to that motion.
Second.
That's a second?
Second.
Okay. Any further discussion? Okay, so, all in favor of the motion, just raise your hand and say aye.
Aye.
Aye. Anyone against? Okay, so, passes.
Thank you.
4-1. I don't want to see you again. Yeah, I mean,
Until
this,
next
Unless
November.
socially, at the Stop and Shop.
See you next November.
absolutely,
Well, if
Figure
you
it
see
out.
me on the street, say hello.
by all means, figure it out.
Yes, sir.
It's not going to happen again.
I know that.
We've
I'm
been very
aware.
gracious.
Yes, you
Whether
have.
right or wrong, I don't know, but that's
You
what's
you
we've
have,
decided.
and I appreciate it. Thank you
Okay.
so much.
Okay, take care.
Thank you.
Okay. Number 6 is a discussion, Board of Health tobacco cap regulation. That's pretty timely. Mr. Murphy, slow down there. Okay, so,
At the last meeting, the Board of Health wanted to revisit the tobacco cap, just as a general discussion, leaving it in. We had a 30-day grace period, and just a general discussion of going forward. At this time, I have not had a chance to have discussions with the state to see how many towns have a cap, how effective it is, and what the state's position is. I do know the state does look at towns that sell tobacco and see which towns are trying to keep it out of the use hands as much as possible, and what the towns have done in the past, such as going to age 21, flavored tobacco, tobacco cap, and there's like a little checklist that they put off on the towns. Has your town done these 4 or 5 things? Yarmouth has always been right there. Not saying that might reduce the opportunity for sale of cigarettes, but maybe it would reduce the opportunity for children or youth to go and get them at different locations. So there's some more information that we could look for, but I think it was just a general discussion by the board of the cap itself.
And the permit application late fees.
And the late fee would be a separate
It's
question.
totally different.
Yeah, I put that as a separate one because that's going to include other retail licenses that come in late.
Gotcha. Oh, yeah, sorry, it's number 7.
well, cap was in effect, and we can think about how we handled it, that's all.
Yeah.
And so that's why I certainly want it on the agenda.
We have had caps that we're working on right now, and one store did leave. We had a vape shop that had a tobacco license, and they left town. So we're already reduced by 1. We have another one that you heard from tonight, 7-Eleven, that closed up and left town. Did not reapply, so that's really 2 that we're down. And then we heard 3 others that the board has reinstated at a different period of time.
So it was interesting, we had support from a lot of the businesses for the cap. I mean, the tobacco businesses
When we
here
first
in town
proposed it, it
were
was-
very much in favor of it. Obviously,
The retail's correct.
there'd be less competition and they would do better. Something to keep in mind. I think everyone is important to keep in mind what the goal of the cap is and how do you feel about that, you know, and is it designed correctly? And something that, Bruce, you've mentioned about the kind of businesses we're trying to encourage here in town. We're certainly in favor of businesses. I mean, that's important to all of us. The question is what type of businesses that, you know, we're encouraging here. People have some
I'm
ideas?
certainly still supportive of our efforts to minimize the availability of tobacco and tobacco products to our youth. I'd like to discuss this further after Bruce has had a chance to find out state-wise where, you know, how many towns have caps, what their experiences have been, if they've been found to be effective. I certainly don't like to have to deal with situations like this, but that's all wrapped up with the next discussion item too, about late permit and licenses.
Yeah, I agree with both things. Obviously, the cap didn't work in this example, but my feeling also, I was supportive of it, and I still am. Since the cap would be interesting to see what more information. Maybe some of us will change our mind about it. Are we on the right track or not with it? And the violations will be key for discussion here tonight about fees and so on.
It would also be interesting to see how it's being administered in communities that have the cap, and if they've faced any issues, you know.
It's interesting, it's been years and years since there's any drop in the number of stores that are selling tobacco, I think. And suddenly this year, there's an issue of 5 of them, right? 5? Certainly was not anticipated. It was.
No.
Should we just put it, anyone else have something to
How much has any of this curtailed the smoking of younger under 21-year-olds?
It's a good question.
Do you know?
Anybody?
After all of this, how much has it done to the youth? Has it stopped them? Or?
You mean the cap, having caps in towns?
Any of this? Has it stopped any of these young kids from smoking?
Well, the smoking rate certainly has gone down, that I know. Whether it's attributed to the things that these towns are doing, including us, that I cannot tell you. But the bigger issues, obviously, were nicotine problems, but it's sort of separate a little bit, I guess. But whether the cap changes the number of people smoking or starting to smoke, I personally don't know. If anyone does, yeah.
I think age 21 was the big difference for people starting, because it was a lot harder access for the youth to obtain that. And I think
Yeah.
that was the big jump.
I can understand that.
And that's only been
Limiting
a couple
the
years.
places you could buy it doesn't make any difference to these kids. I know that a good percentage of cigarettes come out of New Hampshire, especially for the kids, because of the price. You know, what's a carton of cigarettes down here right now? It's got to be $100, $10 a pack. All right, up there's $55
I didn't know
per
that.
carton. So
No wonder, $20,000 loss.
the reason I know that is I still got connections with some of the boys that work up there. You know, so the amount of cigarettes that are sold just over the state line is astronomical.
If there's going to be a cap, I'm not that comfortable reissuing permits because I feel that it
It defeats the
defeats the
purpose.
purpose of the cap.
Right.
And
Sure.
I can understand doing it right now, you know,
Right.
if the need arises, because clearly we have to address the issue because something's not working correctly, but I feel as though it's pointless to have a cap if we're going to be known to reinstate permits
Right.
that would otherwise have disappeared due to the cap.
Well, I think it's also something like if a business leaves town and we reduce the cap, they've left, they're out of business, we take back their permit, nobody gets it.
If they haven't sold it.
If they haven't sold it already, I'm talking if it, should
Yep.
it expire. And then I think that's different from a business that is just late renewing their license. Now, that goes into probably the licensing fee and,
Even if they
late fees and things like that to sort of, because
And-
that's the whole point. We don't want them to not renew their licenses.
And what we have tolerated in the past, which is, you can be late,
Yeah, it's not a problem, you can be late. I didn't think this was going to happen. I just thought people who left town, stopped businesses, and
Right.
the cap would go down. Never thought that people
Right.
would be late to the point they were going to lose their license. I didn't think that far ahead. Never thought that would be the case. So I agree with you.
Well,
It just makes sense to have the cap if we're not going to abide by it, so.
well, but we could modify the cap so that it was put into place in those kinds of instances
Right.
that you talked about. And we could tighten up the late permit license fees so that it disincentivizes people from letting that lapse happen.
Also, I
But-
think I think we've made a very good point with the last three that
I
haven't.
hope so, yeah. I hope that the other
We've
store
already made a
owners.
precedent.
Yeah, that's I know they lost a
So,
lot
I
of
mean,
money, and, and I agree with you, Hillary, we were very gracious and giving that they would have had no license, so.
Right. We'd have to make a decision tonight if we want to put this on the next agenda and to have an open meeting, I guess. If we wanted to, if not, we can just continue the discussion at the next meeting.
Yeah, that's what I'd like to do.
Yeah,
I'm not ready to make a decision
Me
on the
either.
cap tonight to have a hearing and
Next meeting?
schedule.
Do you think you could get
All right.
that information for the next meeting? Awesome.
Yeah. So if it's okay with everyone else, we'd move on to number 7 for discussion, late permit license fees. Director Murphy, anything you want to say about fees and permits?
Yes, as part of the discussion that with the tobacco licenses that were laid on a couple of the businesses in town, it was discussed and was brought to your attention from the staff and myself that several businesses had opened or continued open with their licenses to us by January 1st. Even though we send out the applications November, there was quite a few that wait to mid-January or 1st of February to get their license to us, even though that they were open. Retail stores, not many, but there were a few. So what the board directed myself and the staff to look at is what some other towns are doing for late licenses that come in, and whether that's a food license or a motel license or a pool license or you can see all the licenses that we have come in, whether that's animal license for horses and goats and things like that we have, and chickens, and to rubbish haulers and trash collectors, inns, cabins, and so forth. So we did survey several of the towns, and you'll find at least 10 of the other towns on the Cape address it, but 8 towns have some type of penalty, whether that's a 25% surcharge or double the fee. I should say 7 towns. Or one town, Bourne, has it as $50 per week. So
What does it mean, 25% surcharge?
I think they just, whatever it is, whatever the license is, it's,
Add 20.
because the licenses, some are not very, our license structure is probably about average, when you look at what the cost permit for each town is, when we looked at it, it's been a few years, but what we looked at is not to be the highest nor the lowest, but just be a little bit over average, so that we could be business friendly and work with the community, so it wasn't the highest fees on the Cape. But, and that includes the hazardous waste licenses of businesses that handle woodworking and so forth, that have licenses that are due for handling the hazardous material license, that can be late in getting their licenses in. So the board wanted to look at that, and that's the survey of what they've found from other towns.
I think that the grace period is confounding the discussion somewhat. We're telling people, well, after January 1st, you're operating illegally, but we said, but there's a grace period, so you really have until February 1st to get your money in.
Well, I think that is only in the tobacco license. All the others are due specifically by the end of December. When the tobacco cap was written as working with the businesses and establishment, they said, we will give you a grace period. The other regulations do not have a grace period.
Okay.
I think because tobacco cap was new, wanted to make sure we worked with people. There was a concern that it was something that was coming right down on them without knowing what it is. But we tried to educate them all when they came to the public hearings, when we sent out notices to the public hearing, and including it on their application, that they would see it.
So the grace period didn't exist before the cap? Is that what you're saying?
Correct.
Okay, I didn't realize it. Well, then
What we would do is Phil would keep track, food service would just check with the who opened.
Right.
And the motels knew with the pools that they needed to get a license before they opened.
Right.
So the motels and pools have been very good.
Right. So then we could address that along with the whole issue of the cap, because it's only applied.
Correct.
Right, okay.
And I want to say most of the businesses, a high majority of the businesses are very good in getting their licenses in town.
Mm-hmm.
The secretary works very hard to get, hundreds of applications out by the end of November, to give the people, 30 days so they can, go back with it. Some of the places that do not open, some of the motels that open later, they don't have to get it in right at December, but they need to get it in before they open. So, but we like to give everybody a, fair warning. When you look at some of the licenses, I think probably the people at home don't know that we also issue is funeral director licenses for the 2 funeral homes, and their staffing that we issue. The stable permits, tanning facilities, catering facilities, vapor bath, whirlpools, trailer park. So there's a lot of different inspections besides just the septic Title V pools and restaurants.
Close to 40 of them here.
I know.
Yeah, there's a whole page of them.
Yeah.
Yeah, food trucks, ice cream trucks.
Well,
If you looked at, and I'm just trying to talk to the people at home because they don't have that list in front of us, but a restaurant that has over 100 seats would pay $200 for their restaurant permit and $60 for a a common Vic license for seats. So their license for a large restaurant's $260. So if they didn't get it in on time, obviously that would be twice that. So a lot of them are just, that's the higher license. A lot of them are just anywhere between $80 and $100.
It's just that your job and your department can't be running around trying to get people to send the check in and get their license.
Correct. It's a lot
Dealing
of
with the health of people in town.
follow-up, either letters, a separate letter, a separate phone call, separate letters. It's just a lot of additional time the town staff spends tracking these people down.
and I think the department certainly has a record of bending over backwards to
Yes.
work with people.
Yes, we've been very patient and gracious with a lot of people.
So our goal is so you have less work. You can and spend your efforts elsewhere than this.
I think our goal is to have place is open with a permit that they're required to have by law.
Right, doing business?
On time.
Yes.
Correct.
Yeah. Because, as this last example, I mean, it's going to cost them money if, they're not licensed and they can't.
Yes. We just don't have time to be calling a couple hundred businesses if they're late, or calling them, sending them a letter, talking. And sometimes Phil will go out and do an inspection, and right on the inspection in January, your license isn't complied with, so that's another inspection that he has to go out on. So there's a lot of time spent reminding businesses to get their licenses on time.
Will late fee help that? Or additional late fee? Will that help the situation for you?
I think from talking to a couple of these towns, it has worked well, and a couple towns got their attention that they know that they need to get it in, or they're going to pay.
Because right now, if they're late, they're late. They just pay the fee
Regular fee.
regular fee.
If that changes, does it have to be an open meeting? If you're,
Yes, to go forward, this is just for discussion tonight. If the
Yes.
board wishes to go forward, then we would need, the board's policy's been 2 public hearings. We need 1 public hearing, but we would have 2 public hearings. It would be published in the newspaper that we're having a public hearing. We'd have 1, then a second one, and then would vote it on it that night.
What's the chance if we instated a fee, say a double fee, that people would say, oh, it's only $25, I'll just be late and pay the $50, so what?
Well, that would be a first start to see if the double fee increases it, because you're right, some of the fees are so low, even though they're the middle of the average from the other towns. A lot of fees are low compared to some towns off Cape also. But I think that would still probably catch their attention. I guess it would be something that after 1 or 2 years, if there was still
A lot of
a
late.
number or a smaller number, that could be looked at. But I guess this would be the first start to maybe go easy, even though it's a fee. It's
So
not going to be as high.
Do we know how many of these licenses are late
No.
every year? No. So you haven't kept track of that? No.
I can just say that it's a smaller percent, but yet it can take time. I'm thinking like the hazardous waste license that we have 180 businesses. I want to say probably of those businesses, it's probably at least 15 to 20 that are late each year that Kyle has to send 2 or 3 letters for. And some of these other ones are a little bit later also. But like, again, most of the businesses are getting them in time, so if you're doing it in time like you should when we send out the notices in the end of November, they shouldn't be putting themselves in a difficult position. Especially all let's say all the restaurants that have a liquor license, they know they have to come in and pay for their liquor license. They should do it. However, we did find one business that had a liquor license that did not renew his food service or
Right.
his tobacco license.
Well, and 2, we heard that the state doesn't impose any penalties for being late.
Correct.
So that kind
For
of,
their tobacco license.
I thought it also was for the liquor
Right.
licenses.
Right. Yeah, there's no.
They just come in and say, oh, give us a check now then. And
I mean, it's an important part of their businesses
yeah.
to have a license. I mean, you get pulled over in the car, you don't have a license, the officer's not going to say, oh, yeah, you're late, it's no problem.
Yeah.
It's a license.
Just send a check in.
And the licenses are usually posted on the wall so they, know what the date is, so.
It's the same every year,
Yes.
Yeah.
right?
Doesn't change.
Board members want to make any changes or plans for what to do here with fees, with late fees?
I'll go ahead and make a motion that we double the fee for anyone who is late submitting their required license to the department.
Is there a second to that motion? I'll second it. Any discussion?
Is it, so this would just be a one-time fee when they
Yes.
turn in a
And this
completed
would be for
application.
all the,
For all the licenses that we issued.
But what about operating, without a license? They're selling, if they're continuing to sell tobacco products without a license.
They would be in here for a hearing. 'Cause the tobacco one's a cap, so that would come in here.
So,
I'm confused.
so we would be treating those as two separate things? I mean,
Yes. Yes.
Why
okay.
don't you give an example, one of you, of what we're talking about, so everyone at home understands?
Okay, so somebody forgets to renew their license, and the health inspector goes out, and what would they do, issue a citation for operating without a license?
Right, we would send a letter of violation out probably the first week of November and just say, or call and just say, your license expired, you need to come in within the next, 3-4 days to pay for your license, and there's a double fee.
Okay,
I would say if they don't come in with that call of the 3-4 days and they're going to continue to be longer, we would schedule a Board of Health hearing to ask them why their license should even be reissued, because they have no license. So we should say, should we reissue your license
That'd be for any of these.
for any of them?
Yeah.
On tobacco, it's specifically written into their regulation. These other are a mixture of town and state licenses requirements.
Some are products and some are services, I guess.
Correct.
Right.
Okay, so the funeral home is late, what happens? Okay, they have a license,
They would get called, they would have to come in and pay double.
okay. Any other consequences? Let's say they come 4 months late.
Well, like I said, if they didn't respond after the first week and come in, we would bring them in for a hearing and say, why are you operating without a license and as required by state law?
Would they not be able to have a service, have a funeral until they come in front of the board? In other words, we didn't allow these people to sell cigarettes until this get dealt.
I think we'd need to check with town council on that question.
Yeah, I know, I'm giving an
Yeah.
example.
And possibly
Humor here, but it-
town council, and possibly town council, if we could issue a fine for businesses operating without a license. I believe we probably could. But I think trying to work with them to get them in the first week, I think would be gracious. And I think by paying a fee or knowing what they'd have to pay a double fee, and it's right on their application, we'd put it right above their signature line on the applications, tobacco, double fee for permits. They should understand that.
This seems like a very simple thing right now, but there are other issues that you're bringing up as well.
Right.
It's a lot more complicated than just paying double. I mean, that's.
right.
is this something that has to go, is a town hearing, or that's just the cap?
Just,
Board of Health hearings.
I'm sorry,
just
the Board
us,
of Health hearing.
just us,
Okay.
So
So the
it-
fine, that's something we can,
Would ju-
I
would-
mean, the late fee.
would be
that's-
us. Right, the board would have to hold 2 public hearings, and we could do that at our, next 2 meetings.
And that's for the cap?
No.
No, that's
No.
for this.
This is just for the late.
Late
We're
fee.
still just talking about
Just
the
talk
late
the
fee.
late
It has
Okay.
nothing to do with what are we going to do with that business. It's
Right,
just the
right,
fee.
Right.
Okay, I
Fee
understand.
is the easy part, whether you're in favor of it or not. So this is discussion, by the way, because there is a motion on the table. So any other further discussion about the late fee? And the motion was to double the late fee. If not, we'll go ahead and vote.
It looks like Bourne charges per week for a late fee. I'm kind of in favor of that, because if you, whether it's by the day or the week, but I don't know, how you guys feel
I
about
guess
that?
my thought on that would be, we're trying to get everybody in the first week, and if not, give them that week to get it in. If not, they're going to come to a Board of Health meeting. It's just trying to keep track of the weeks. Is it 2 weeks? Is it 2.5 weeks? Is it when it was date received, when it was postmarked? When did we receive it? It just seemed to be following a couple other towns that doubled the fee, seemed to be a little bit easier administrative-wise to look at the permits.
Sure.
Certainly, you know, if this motion goes through, it would be helpful for you to keep some running tab of, is it making any difference? How many late fees there are this coming year versus the following year? Maybe it's accomplishing nothing. If it's the
Well,
case, do we want to increase
right.
it? Whatever. Is it helping you?
And the board can hold 2 public hearings for comment, then after the second hearing, the board can say what they heard from the public or not heard from the public, and decide from there. So you'll still have
Right.
2 more times of discussion.
Decided.
So can we just,
Right.
can we revisit our hypothetical scenario where a citation's issued and then the permit holder comes in for a hearing, and the hearing is because they are selling without a permit?
Correct.
So in that hearing, what would we be discussing? Whether or not to?
Should they get a license? Let's say a motel comes into us, a motel or a restaurant comes into us and says, you know, I got the letter from Bruce, and the 1st of January, I was late. I got the letter from Bruce. He's still, the health department, and I still didn't turn it in. And it's been 3 weeks, and they've scheduled a meeting before the Board of Health. The question is, should we issue that license to the restaurant to continue opening?
The motel. And they'd pay $220, right?
Correct.
And then
Double it.
we decide whether or
Right.
not they would open. Is that how I'm understanding?
Right. And we could look at, and I can check with town council to see if there could also be a separate fine issued also.
Meaning what?
So on top of that, you have to pay double, but I think that is really the fine, by paying, that you're paying double versus,
Right.
Right,
So
right.
you're not saying there's something else?
Right, no.
Okay.
Right.
Why haven't we seen these people here before for the late
because
fees?
it's a small percent, but it continues, and I thought it brought it more to light this last time, and the question came up, are there other places
Right,
that are
right.
late?
Right.
And yes, there are other businesses in town, some of them that are late. And you saw one of them that was late the last 4 years and didn't get it into the end of January.
Right.
So it's a small percent, but it does take time consuming, as I said, writing letters and visiting the store and calling. And I don't think any of them probably want to come in and before the Board of Health on TV and explain why they're not in compliance, because that,
No.
you know, they have to be in compliance with other issues, whether it's inspection items and keeping the place, you know, clean and so forth. They have a responsibility to keep their property up to code.
Any other discussion? Okay, everyone remember what the motion is? It was a while ago, so. All in favor, raise your hand and say aye.
Aye.
Unanimous, okay. So, Director Murphy, how do we proceed then?
I'll put an ad in the newspaper, and we'll put it on for our next meeting, April 6th, and then probably April 20th.
Great, thank you. Okay. Number 8, this is discussion of obesity, and this is an issue that I had brought up. This is not coming from Bruce, and it just came, something I've been thinking about over a number of years, and I guess it got reminded by just a couple articles I read recently on the issue of obesity. We're not really talking just about being overweight. I mean, we're truly, I mean, we're talking about people with obesity, which means an excessive amount of weight. And, you know, we've put a lot of focus on tobacco, a lot of, certainly on narcotics, and there are more people, probably it's safe to say, are dying from obesity, and it looks like it's increasing. You have to remember that people who, with that much excessive weight, they're at risk for diabetes. It's type 2, actually. People who are more likely to fall, break bones. Falling is one of the, certainly in the elderly, is one of the greatest causes of death is actually falling. There are people who go through a lot of surgery for replacement of joints. A lot of it's based upon the impact. People who, you know, are 80 pounds overweight and so on. And there's the issue of heart disease. People who are obese tend to be hypertensive, have very high blood pressures. That's, you know, stress on the heart. often it's about the type of diet people are eating, which can certainly affect their cholesterol levels, puts them at risk for heart attacks. You know, you think about, we all have a pump, our heart, and if you've got miles more of capillaries and blood vessels in fat tissue, and fat tissue requires a lot of blood. It's just a tremendous stress on the heart. I mean, the heart has to pump harder and faster, and it's just so it's something we haven't, at least since I've been on board, ever talked about it. Focus has been on other causes of disease here in town, and the only thought I had is what happens with kids in school and what the kids are eating, and education about dietary habits. A lot of it comes down to money. It's, you know, food is costly, and cheaper, less expensive food often has more calories. It's not as beneficial, and that's certainly a problem in our town. And you know, I personally don't know what school lunches are like. And certainly in the elementary school, I know, Bruce, you've mentioned the high school. They tend to have salad bars and all. The habits of how we eat start pretty early in our lives, and maybe we should address some attention to this at some point. It's a big problem, and it's increasing from the reading I've done. So it doesn't mean it has to be a full discussion. It could just be my giving.
What do you plan on doing? Are we going to close Burger King and McDonald's? Are we going to start charging people extra for a cheeseburger? Or
We're going to look at what the schools are doing, how they're serving
I think
food.
the schools are doing pretty good at the moment,
I don't know.
you know?
What are they doing good? What are they doing well?
You can educate people all you want, but if they're going to eat, they're going to eat. And,
What are they serving the kids in Yarmouth?
yeah,
I don't know.
but, you know, it's like telling somebody, you know, you can't eat this or you can't eat that. Well, it's still up to them. They're going to do what they're going to do, and that's how this is happening. I don't see as there's anything we can do about it short of, you know, cooperating with the school lunches, you know, with the kids. That's where it's all going to start anyway. You're not going to take somebody 65 years old and tell them all of a sudden they got to lose 100 pounds or they're going to pay a fine or something stupid here. You know, this ain't going to happen. But if you can educate the kids and they can, you know, what do kids do today for exercise?
That's a good point. On the computer.
You know, what are they
Exercise,
doing?
yeah. I just think it really is the young kids. Is really why I've brought this up. And I don't know what happens on the lunch line at schools, what they're getting. I know what I did. It was a bunch of fried food without any taste, and that's what I ate growing up, the elementary school.
Pizza
and
Fridays still happen.
So what's on the line when the
So, I
7-year-old
mean,
goes
as a-
down getting the food? I don't know what their choices
You know,
are.
a lot of the kids today, they don't get a chance to work off any calories. They sit in front of the TV and play video games.
Well, I know the health department has sponsored the bike days and the helmets and all, right?
Right.
I have yet to see more than a dozen kids a week on the bike trail. They're all grown-ups or elderly.
I
Well, that's
believe
good.
the Wixon School got a grant to get a salad. I don't know what the grant was, but my understanding is
Yes.
Wixon got a salad bar recently. Yeah, and it was a huge
Success.
win for
That's
my
great.
daughter went to Wixon, and I still follow
Yeah.
the page, you know, on
Right.
Facebook, and I forget. I would imagine it was whoever the lunch person is
Right.
there. Is Rooney?
Can we find out?
Yeah,
we
we
hear
can
from
find
them?
out. And
Yeah.
I've worked with the school food director over the years,
Okay, good.
trying to increase the salad bar to lower levels. And I know at one time we said they would have to hire additional staffing was always one question. It's probably why they went for a grant.
Yeah.
The schools have removed the fryer-laters in the schools, so they don't do fried food anymore. They probably removed them, 10 years ago maybe. That's been. They do have it at the football field in the shed. That's where they make their money.
Right.
But at the school programs, they don't have fryer-laters anymore, and that's been a number of years.
Yeah, they do. So it's, I mean, this is a couple years for me anyways, but they offer fresh fruit.
Yeah.
They have vegetables. They have nut alternatives like sun butter, things like that.
Yeah.
They have, it is different.
They
from
have a
when
lot
we
of
went
different
to
healthy
school.
things, so.
Yeah, they do have healthier choices, but they still do have tater tots and pizza on Fridays
Yeah.
and, you know,
But let me talk to the food director and see if I can schedule a meeting where that person
Okay.
can come in and talk to us.
Or you and I can go and have lunch?
I was
at
going
the
to say,
elementary
well,
school.
she could
Yeah.
bring food,
Salad bar
some
day.
samples,
Yeah.
samples, right?
Sample day.
Do they have soda machines?
They
Do you know?
do at Madakee's. I've gone there
Yeah.
recently for a basketball game. They have a vending machine too. Now I can't tell you exactly what's in it, but I know they have a machine and a vending machine at Madakee's. Just because I was there a few weeks ago for a basketball game.
Well, that's something to ask the food director.
Now there could be all healthy snacks in there. I didn't look, so I
Right,
just can
right.
tell you there's vending.
You can tell us, what did you get?
I can tell you.
What did you choose?
I can tell you there's a vending machine. I don't know what's in either of them. They could be perfectly fine.
Yes. We can do a little further looking at that.
But just to speak to what Hillard was talking about, as someone who was very overweight, with high cholesterol and high blood pressure and pre-diabetic, losing 90 pounds, I now have no sign of any diabetes.
Yep.
I have awesome cholesterol, and I have, my doctor told me I have the blood pressure of an athlete. So,
Oh,
I mean, that's,
congratulations.
I
Wow.
mean, I'm not.
It works.
I'm not like looking for pats on the back, but it really is, thank you.
It's a lot of work.
It's a
Yes,
lot
really
of work,
hard.
and to Charles's point, it's something that it's a personal
Yeah.
decision.
worth it.
There's not, it is totally worth it, do it. But yeah, it really does, it almost will fix knee problems, it really, you just ticked all the boxes, so I felt like I needed to say something.
Congratulations.
My daughter
Good work.
lost 65.
Yeah, and your daughter lost a lot of weight too, I'm sure that's
I
helped
never
her.
said a word when she was heavy or nothing else. I just left her alone, and every once in a while I'd cook something or whatever. But it's got to be a decision they make on their own. No different than quitting drinking or drugging or anything else. You got to get to a point where you say, I've had enough of this. Some people just don't get there.
Okay. Approval of,
Enough about it?
yeah,
Yes, okay.
Ooh, Mary's done.
We'll talk more about it.
approval of minutes. Everyone take a look. People have some editing to do. I looked, it
I should
looked
forget
fine to me.
Fine to me.
Anyone else have any edits?
Looked
Any-
fine to me.
No?
Needed to make? Okay, so what's the next step we normally do?
I move we approve the Board of Health minutes for February 10th, 2020.
Second?
Okay, all in favor, say aye.
Aye.
Aye. Okay, so it's minutes. Old and new business. Director Murphy, you're on.
I would just like to congratulate our secretary, Mary Alice, that's been with us 29 years, has taken a position in the Selectman's office, which is an upgrade on position for her, so we're happy with that. So we'll be looking to fill that position, so she'll be doing some part-time work with us, but we're going forward with that. So it's going to be, a little thin this coming month. And then Christine has already scheduled a 2-week vacation, so she'll be gone during this time.
Not out of the country, right?
Yeah, no. And then Mallory, our assistant, her active military reserve is next week, so she'll be gone also. So we'll be thin, so I'll be out doing an inspection, so
Answering the phone.
answering the phone. So Meredith, that's our person that's been with us. Summer has been very helpful, so she's able to get on the phones and answer a lot of
Good.
questions also. So
That's great.
it'll be a challenging month.
Any update you can give us on coronavirus?
The state still says, we listened to a Department of Public Health update today, and the state's Department of Public Health position is still low risk at this time. They are reaching out and said that they will keep the local boards of health updated on various issues, and there'll probably be another call next week as part of their reaching out to local boards of health. So nothing more. Any people have questions, we have it up on our website, within the Health Department on the town webpage. It has the Department of Public Health information on the coronavirus, and also a State Department of Public Health 1 or 2 phone numbers to reach out if they're looking for further questions.
And cdc.gov.
And cdc.gov.
Do you have
I
any
believe
of the
that
phone
one.
numbers? I didn't bring it with me for the,
Bring it with me.
you did
They're
not.
up on the website.
anyone know it offhand for the Massachusetts
No.
Department of Health? Yeah, so they have a lot of people answering phones there, actually. Just the public, people can do a few things, right? So when they're coughing and sneezing, do it in your elbow.
Cover it.
And the flu's still out there in full
T-shirt.
force. My daughter
Yeah.
had it last week.
Taking my daughter's sweatshirt.
The,
Inside of it, she goes, "No,
18,000 people have died from the flu this year in this country. So to keep that in perspective, it's not too late to get a flu shot. Certainly, this coronavirus affects people's lungs primarily. That's where the problem is. And so the last thing someone would want to do is have influenza, have the flu, and then get another virus. It's the time to probably get your vaccination. In fact, if you haven't had your pneumonia vaccine, it's a good time to get that as well. Because you really, if this thing spreads, you really don't want to be going to the doctor's offices or ERs when people are sick.
Oh, yeah.
So you're better off seeing your doctor now. If you need a renewal of your prescription or any vaccines, it's a good time to do it. A couple other things to keep in mind is washing your hands frequently. And another thing is to keep your hands away from your face. This virus will stay on us, on surfaces, for quite some time. And
I know
so,
with 3 surgeons right now, when you come into the office, they take your temperature on your forehead.
absolutely.
For 100 degrees, they tell you to leave.
That's interesting.
Yeah, so, and your questions, you certainly, call the state. You can call your doctor if you had to. You'd have to go to somebody's office. If you're not that ill, you can call your doctor. It's helpful. If you had to go into a walk-in center, you can do that. Unless you're really acutely ill, the ER is probably not the first step to make if you can avoid it. Obviously, you're really ill, then you need to get to the emergency department. Hopefully that doesn't happen to people. The sanitizers are helpful, okay? And the advice I give people is they should put enough on their hands. It takes 15 seconds for it to evaporate. It's a good call on it to make sure you're using enough of it.
Masks do not help. So don't hoard masks. We need them for the healthcare personnel in case they are called to help.
We're running low. That's true. Anything else on the old or new business? Okay. So next meeting will be the 6th?
6 and 20, April 6th and
Yeah.
April 20th.
Yeah. So if anyone wants to leave, someone has to make a motion. That's the only way this is going to work.
I move we adjourn.
Second.
Dick, all in favor?
Aye.
Aye.
Thank you, everyone.